Ladies and gentlemen, please welcome Jose Fernandez, U.S. Department of State, Undersecretary for Economic Growth, Energy, and the Environment.
Good afternoon. Good afternoon. The COVID-19 pandemic laid bare the importance of resilient global health networks, revealing inequities within our health systems. We saw firsthand the impact that health security has on our global communities and economies. Far too many precious lives were lost. Each of them reminds us that we have to work together in order to avoid the next pandemic at all costs. In July of this year, Secretary Blinken launched the Bureau for Global Health Security and Diplomacy at the State Department to elevate and integrate global health security as a core component of U.S. national security and foreign policy. This bureau, headed by Ambassador Nkengasong, leads U.S. diplomatic health engagements and programs in the prevention, detection, control, and response to infectious diseases, including HIV/AIDS. It's imperative that we remember and that we learn from the last pandemic. The response from the private and public sectors then was remarkable. But to be ready for next time, we need to build regional resilience for economies and health systems alongside our global response. When I arrived at the State Department 2 years ago now, I was determined to address the regional health security challenges because I saw firsthand the impact that the pandemic had on regions like Latin America and the Caribbean, where with 8% of the population, they had over 25% of COVID fatalities. To combat these regional inequities, the State Department last year launched the Economic and Health Dialogue of the Americas. The EHA brings together health, finance, and trade ministers from countries all across the Western Hemisphere to address shared common challenges such as health financing and resilient supply chains. We designed the EHA to be a regional forum for governments to have frank conversations about their experiences on COVID-19 and also to coordinate a strategic recovery, and we worked with the support of the IDB, PAHO, and the OAS. A regional perspective is necessary to move forward on broad health goals and share information and benefits gained from bilateral investments more broadly. A key piece of this is economic resilience and supply chain strengthening. At the first EHA meeting that we had in Panama last March, we had 18 countries represented by their ministries of health, foreign affairs, finance, and economy gathered together to work at the first annual EHA high-level meeting. I'm proud of the Western Hemisphere for prioritizing this issue and for being trailblazers in the public health sector. But let's keep something in mind. These issues are not limited to Latin America and the Caribbean, something that the ambassador, who you will hear from soon, knows well. And we intend to implement the same model in other regions of the world. So with that, let me turn to our program. We'll hear from our distinguished speakers on their vision for rethinking health diplomacy, and how we can better foster and apply innovations for more accessible, equitable, and resilient health systems. Thank you all for joining us today. And with that, Ambassador Nkengasong, the floor is yours.
So, we had a fun moment when we prepared for this because we weren't sure who is supposed to ask the questions, and in the end we came to the conclusion that I should be the one here. So, which is very good for me. So, Ambassador Nkengasong, it is a great pleasure to see you, and congratulations, if I can say, for the to the big challenge you put on, or you took on. It's maybe with all your experience, as a CEO of one of the big medtech companies. When you look at innovation, yeah, what are the key innovations driving health equity and driving really progress in healthcare when it comes to really public health, when it comes to the health security topic here, which we just heard about?
Absolutely. First of all, good afternoon to everyone. Really good to see very many familiar faces in the room. And Undersecretary Jose Fernandez's comments were just apt. He talked about the experience of COVID in Latin America and the Caribbean countries, and with a very specific focus on the need for regional health security. The need for regional health security. I think I lead with that because when we rethink healthcare, we have to be bold in what we are trying to achieve, and we have to be courageous in what we are trying to do. I've always reasoned innovation not in terms of new technology, but also in terms of structural innovation. What is it that we can do boldly that will take us to the next level? In other words, how can we reason or begin to think or continue to think globally, implement regionally, and act nationally? That's what I heard from Undersecretary Jose Fernandez just telling us, that our common security, health security, will depend on the ability for all of us to make sure that we provide access, equitable access to healthcare at national level, regional level, and global level. We saw during the COVID-19 pandemic how scarcity became a driver of inequality and inequities. Scarcity was the driver of inequality and inequity. I don't think anyone went to a boardroom and said, well, let's just share the vaccines only amongst us or diagnostics and let these low-income countries just not get anything and they would die and will just be good. I don't think anyone reasoned that way. It was because of inequality, a scarcity of technology. So what does that mean in terms of rethinking healthcare with innovation? It means very intentional investments at national level, very intentional investments at regional level, and at global level to think collectively, act collectively, and implement differently.
I mean, one topic which moved me during the pandemic is that I mean, it was very obvious to see, you know, with like looking at these Johns Hopkins dashboards, you know, you can see progress and you can see infection rates, you can see vaccination rates, and so on. And I was thinking about, hey, if we had this also for the pandemic, we are kind of used to, like cancer, yeah, and the other NCDs. Mm-hmm. It would really, on the one hand, help, but it will also show inequities, and there maybe the scarcity is not so much the problem. Yeah, so I mean, you're coming from the infectious disease angle.
Yeah.
When we look into the future, we will see the NCDs becoming more and more important. Yeah, also in LMICs. What can we learn from infectious disease? And how can we also use the existing infrastructure to step-by-step switch to fighting cancer, fighting cardiovascular disease, and so on?
So, very interesting question. The way I always approach that thinking is that we should conceive a platform approach in the way that we fight these challenges. We find ourselves at an inflection point where climate change is affecting food security, health outcomes. We live in an area where outbreaks are getting common. We just dealt with one pandemic. We live in an era where existing infectious diseases are still there, especially in resource-limited settings, i.e. TB, malaria, and HIV. So what is the platform approach that drives my thinking is for us to think of where we came with the cell phones. When the first cell phone started showing up, they were very basic. It wasn't a platform. The Nokia, the Ericsson, you had that phone and you did one thing with that phone. It was to call you, okay, and you returned my call. Then they evolved into the computers that we carried along, which we call cell phones today. That is a platform, which is not just a phone, but it's a whole computer that you carry. So why is this important? If you look at the platforms that we've put in place to fight infectious diseases, and permit me fall back into the experience with the President's Emergency Plan for AIDS Relief, PEPFAR, which has helped save 25 million lives, prevented infections in about 5.5 million children from being born of HIV/AIDS. Huge horizontal platforms have been established there in the areas of workforce, in the areas of digitization, in the areas of transport systems, okay? So the question you ask is, I interpret it to mean how can we use those systems that already exist, leverage those systems to fight non-communicable diseases. The number one killer in the world now is not infectious diseases, it's non-communicable diseases. But they do not have unique platforms like infectious diseases to fight non-communicable diseases. So what do we do with the digitization that we've learned in infectious diseases, the human resources that we've all acquired in there? So I think the platform approach says that we should diagonalize our efforts as we try to solve the complex issues that I call the inflections that we're dealing with.
Maybe a bit of a personal question. Yeah, when I grew up in the business, I'm in since I can think. Yeah, in Siemens Healthineers. Yeah, which is and I had a role in medical imaging. And when I grew up in this business, I was very much focused on developed countries. Yeah, it was about, hey, this is the cool MR machine, and this is the cath lab, and so on. And what was, so to say, easy is that the infrastructure to buy or to operate these machines is in place, like in the island of Manhattan. Yeah, you have a university or an academic medical center, you have trained physicians, you have a reimbursement system, and so on. And then the role of industry was kind of easy. You supply, and of course you need to have the right technology. Yeah, then it's about building up a health care system. Mm-hmm. It requires a completely different thinking. Yeah. So what is your wish to the private sector in these areas? Yeah.
Yes.
Where we cannot be stuck just because of a chicken and egg problem. Mm-hmm. Yeah. So the infrastructure is not there, and that is why there's no technology, and vice versa. So what are the best tricks to crack that nut from your perspective?
Yeah. So let me just say that without strong partnership between public health infrastructure and systems and clinical care, partnership with the private sector, you go nowhere, right? Because in public health, you conceive what the issues are, but you don't have the know-how to develop the solutions. And example, vaccines. Okay, a public health expert knows that vaccine is the most potent intervention that has ever existed in the areas in fighting infectious diseases. But that's the limit of their understanding of the problem and the issues. The solutions come from the partnership with the private sector. The diagnostic world is similar. We know what the question is, we don't know how to produce that product. So that is partnership. Digitization. I'll give you an example in my previous job where at the Africa CDC, Centers for Disease Control, we were all surprised with the COVID-19 outbreak, right? Nobody was ready for a pandemic. We knew a pandemic was coming, but we just didn't know how quickly it was. So here we are, and the scarcity and inequality of access to commodities. What did the private sector do? Reach out to the private sector, and they produce a platform called amsp.africa. amsp.africa. You can Google that and it will pop up like Amazon.com. And that platform became a platform where countries went in Africa, pulled what they needed, put it into their baskets and pay and check out. And they were delivered. So that is innovation that is driven by the private sector, and it was all sponsored. The platform underneath was all sponsored by the private sector. I knew what I wanted, but the development of that tool was in the hands of the private sector. So public-private sector partnership is so critical and will continue to be so critical as we fight disease threats in what I call syndemics. That is the rising threats of non-communicable diseases, emerging infections, and the current endemic diseases. You need that interface between the private sector and the public sector to strengthen public health systems and clinical systems.
Yeah, absolutely. I mean, that's also something I observed over the years, that the role of companies is changing. We are taking on much more responsibility. We are not yet where we need to be, but I think the mindset is definitely changing. But I also really appreciate that there's much more openness for new ways of collaboration in the public sector and in the NGOs. Maybe as a very last question, I mean, one big global challenge is the shortage of healthcare workers. Whether it's in countries like here or in LMICs. What is your view on this, and what is, from your point of view, the most important thing to do for all of us to overcome this challenge?
I think we, given that our time is up, I think we have to be more intentional in the training and retention of healthcare workers across the board, from community healthcare workers to nurses to doctors. And stop counting on the fact that labor from low and medium income countries, migrating labor for healthcare will solve the problem. It will not solve the problem. I just came back from Nigeria, and we heard statistics that over the last couple of years, 20% of healthcare workers in Nigeria have moved to the developed world to look for greener pastures. We are not solving the problem by doing that. We are aggravating the problem. So we just have to be more intentional, set targets collectively, and agree to hold each other accountable that we are meeting those targets that we set for ourselves.
Okay, cool. Thank you. I think our time is up. Thank you for your insights.
Thank you so much. Yeah.